Hello, and welcome to the Opulent Life Healthcare Radio Lounge, your ultimate destination for a healthy dose of information, inspiration, and relaxation. Our healthcare professionals are thrilled to be your guide by answering questions that relate to your health. Whether you're sipping on your morning coffee, taking a break from work, or just looking to unwind, you've come to the right place. The Healthcare Radio Lounge is here to provide you with a soothing and informative space where we explore the world of health and well-being. Our mission is simple: to empower you with the knowledge and the tools you need to make informed decisions about your health. The Opulent Life team believes that health is a holistic journey encompassing both the body and the soul. Now, let's get started with our healthcare professionals answering your questions.
Hi friends, and welcome to Health Snippet, where we address community issues and we discuss medical problems and we talk about health and well-being and how you can live your best life. My name is Rebecca, and I have been a registered nurse since 2012, and I have worked many avenues in the healthcare field. So my experience, the bulk of my experience has been done in a hospital setting. I'm a trauma nurse by trade, and I just love community health. I love answering questions. I love being able to share my well of knowledge. We don't gatekeep over here. So what I know, you can know. I want to give a bit of a disclaimer and just express that I am not a medical doctor. If you are experiencing symptoms of a medical condition that has not been formally diagnosed, then I would advise you to see your medical doctor and get the appropriate tests and the appropriate interventions going through an MD. I am not encouraging anyone to stop their current medical treatment, nor am I encouraging anyone to start a medical treatment. You really need to be following up with your doctor, and I will say that 1,000 times. I am just a registered nurse, so I am just sharing what I know with the community to help educate everyone on how to live their best life in the most healthy and fulfilling way possible. So with that being said, let's go ahead and dive on into our question for today. So this question is coming from a young lady, 32 years old, and she has been diagnosed with Polycystic Ovarian Syndrome since the age of 22. I'm going to read her question, and then we'll go ahead and kind of dive into a couple of things for those of you that are not educated on exactly what Polycystic Ovarian Syndrome is. Your questions, when you write in, we do not disclose names. We're not here to embarrass anybody or call anybody out. We're just here to simply share a wealth of knowledge about particular topics. So let's move forward. So this young lady has written in, she says, "Dear Nurse Rebecca, I am a 32-year-old and I was diagnosed with Polycystic Ovarian Syndrome at age 22. I am really trying to cope with the symptoms of PCOS, but I'm having a difficult time. Can you give me some tips on how I can properly manage my symptoms and not feel that this is a hopeless cause?" Girl, listen. I am here to tell you, PCOS, it kind of hits home for me because I was diagnosed with it, I'd probably say maybe around that same age, that 22, 23, and it just came on with a vengeance. You know, nobody really tells you that growing older it can be a bit difficult. Nobody says that. Nobody gives you a book. Nobody gives you an outline on how exactly this aging process goes. So this one kind of hits home for me. So I do want to indulge in what my personal experience was and the things that I had to change, hoping that it can help you. But let me back up a little bit for the general audience and just kind of give a little education on what exactly Polycystic Ovarian Syndrome, aka PCOS, is. So for those of you that are not familiar with the syndrome, PCOS, or Polycystic Ovarian Syndrome, is a condition in which the ovaries produce an abnormal amount of androgens, male sex hormones. So as a result, this can cause numerous small cysts, which we all know that a cyst is a fluid-filled sac that can form inside of the ovaries. Now, the cause of PCOS hasn't exactly been determined. It's not really clear, but there is supportive research that says that women with PCOS oftentimes will have an insulin resistance, which means that our body produces insulin, and in women that have PCOS, the body can't really use the insulin as well as it should be able to use it. Insulin levels can build up inside of the body and can cause these higher androgen levels. Also, women that are more obese, they can have these increased insulin levels, and it can actually make PCOS symptoms even worse. So, some of the symptoms that this young lady may be experiencing, I noticed she didn't really go into details on exactly the symptoms that she was having, so I'm just going to kind of touch on some general kind of symptoms, which are, of course, missed period, irregular cycles. Some women may even have menstrual cycles, but they can also be very light. The ovaries can be enlarged in size. They can be present with cysts. I know when I was diagnosed, my doctor actually referred to my cysts as a string of pearls. She just said that there were a multitude of cysts that were just like a pearl necklace inside of my ovaries. So that's a symptom that can occur, and of course that would be confirmed with ultrasound. Excessive body hair has been one of the main complaints that I've seen patients that have PCOS. Excessive body hair, including like hair that's growing on the chest, the stomach, the back. So that's one of the major symptoms, of PCOS. Weight gain, especially around the abdomen, acne, oily skin, thinning hair, male pattern baldness, infertility is another big one, and we'll talk about that in a little bit. Skin tags, which are those like small pieces of excessive skin, and that can happen like on the neck and the armpits. Dark or thick skin patches on the back of the neck, armpits, under the breast. These are all just some of the symptoms that individuals may experience when they have this particular syndrome. How is it treated? So I feel like in the question, this young lady was asking, how can she manage her symptoms? Treatment for PCOS is contingent upon what your plan is as far as fertility is concerned. So many times, if you have a woman of childbearing age that is looking to become pregnant, treatment could include changing your diet, increasing your activity, and medications that cause you to ovulate. So healthy diet and physical activity can really be helpful with this particular condition. If you are overweight, losing weight can help to reduce your symptoms. Also, it can help to improve your insulin resistance and help your body to utilize your insulin more efficiently. Many women with this particular condition, with PCOS, have a difficult time with becoming pregnant, and they do need help. So medications that can help you ovulate, they will help your ovaries to release that egg normally and help to increase your probability of becoming pregnant. I do want to let you all know that a lot of times these medications that do help you to ovulate can actually bless you with multiple births. If you are not planning on becoming pregnant, then there are other forms of treatment, such as birth control, which can really help to regulate the menstrual cycle. It can also lower the androgen levels, and it helps with reducing that adult acne and that kind of oily skin that can cause adult acne from this condition. Also, diabetes medication, in my experience, usually the first line of treatment for PCOS for an individual that does not have plans to become pregnant is metformin. And metformin can help with the insulin resistance in PCOS, and it can also help to reduce the androgen levels. It can slow, diabetes medication in general, it can slow the hair growth and help you to ovulate more regularly. In addition to that, also changing your diet, again, activity, and other medications that can help to treat your symptoms, such as reducing the hair growth that you may be having, also the acne. I have heard some patients say that they have undergone like laser hair removal treatment. I just want to encourage you that as a person that has PCOS, it does get better. It really does. It just takes the right team of doctors, it takes the right GYN, and it takes willingness to, be more physically active and be willing to make those lifestyle changes so that you can feel better. I tell people all the time, when it came to this particular diagnosis, I didn't realize how bad I felt until I started to feel good. And a lot of times we just will walk around with conditions and we'll walk around with, medical problems, and we don't realize how much it's impacting our day-to-day life because it's been with us since we could remember. How do you manage your symptoms? I would say the first step that I would do is find myself a good GYN and discuss my options in treatment. I would encourage that GYN or your doctor to test your hormone levels, get some blood work, kind of see exactly where your glucose levels are, take a look at your cholesterol levels, and start to treat anything that they see. Again, and then as far as your responsibility as a patient is being willing to make those lifestyle changes, which is not easy because it's very difficult to make lifestyle changes when you don't have the energy to make it. It's easy to say get up and go for a walk every day, but if you just feel like garbage every day, how do you get the energy to get up and walk? Or to take care of yourself like that. But we have to put forth a lot of effort. When I changed my diet and kind of went a little bit more, less processed food, of course, cooking my meals, trying to incorporate kind of like that Mediterranean kind of diet, increasing my amount of fish and vegetables and, using olive oil instead of butter and things of that sort, I did start to notice a change. And I started to notice a change with my body. I started to notice a change in how I felt. I had more energy. I, did not feel like I was, kind of bogged down all the time. I just kind of felt like my energy levels were just garbage. And I did start to see a change in my menstrual cycles go from very irregular to being very regular. Living with this condition is not, easy, but there is help. The help just kind of depends on what exactly the condition is doing to you. And again, getting the right team of doctors is so important with this condition my experience with PCOS is different than from someone else's experience with PCOS. Though we may all fall under this generalized umbrella, there's not a cookie cutter way of treating it. It's really individualized. So that's why I would encourage you to go out, get that GYN, get that blood work done, get moving on, a healthier diet, more physical activity. The point is to start moving and start making changes so that you can feel better. And again, I think the biggest thing with this condition, what I really hope that you take from this, is getting a good team of doctors. So my advice to you would be definitely get a GYN on board. I hope that your journey with PCOS can be resolved so that we can get you feeling good and get your, fertility where you want it to be, if that's important to you. And, and just get you feeling better overall, because I know that this can be a very miserable condition, especially when you haven't, gotten the tools that you need. I know from personal experience, it can be very miserable. And I just encourage you and hope that you get the relief that you're looking for. Good luck on your journey, my friend. And please keep us updated and posted.
Thank you, Nurse Rebecca, for answering our reader's question about OCPS. As Nurse Rebecca stated, please remember to consult your doctor with all questions and concerns. Again, as Nurse Rebecca stated, Polycystic Ovarian Syndrome, PCOS, is a common hormonal disorder that can affect women of reproductive age. She gave tips on how to manage. Let's recap. Lifestyle changes to manage is important. Adopt a balanced diet that focuses on whole grains, lean proteins, fruits, vegetables, and healthy fats. But make sure that you avoid or limit processed foods, sugar, and refined carbohydrates. Engage in regular physical activity and be cognizant of your weight. Weight management can help regulate your menstrual cycle and improve PCOS symptoms. Medications may also be needed. Make sure that you talk with your health provider to see what medications will help you. Remember, everyone is not the same, so you have to have a customized health plan to help you. Nutritional supplements may also be an option, along with stress management. High stress levels can worsen PCOS symptoms. Practice stress reduction techniques such as yoga, meditation, deep breathing, exercising, or mindfulness. Hair and skin care and sleep hygiene are also important during this process. We want you to make sure that you maintain regular checkups to monitor your overall health, hormonal levels, and any potential complications associated with PCOS. Thank you for joining the Opulent Life Radio Healthcare Lounge. We are here to provide our community of readers support through our healthcare professionals. Have a question? Well, we would love to hear from you. Send all questions to opulentlife@gmail.com. Next time you listen, it may be your question being answered. Until next time, keep striving to live a holistic life, because it's a journey.